Good evening. I had the Safe Patient Handling Program for the Cityview Medical Center, um, strain behind the care. So, for the hazard identification, the specific hazards present at Cityview Medical Center include the manual lifting or repositioning of patients without the use of assistive equipment. Although there is a safe patient handling protocol in place, mus- musculoskeletal injuries among the nursing staff, particularly back and shoulder injuries, has increased sharply over the past 12 months. Staff has cited time constraints, equipment availability issues, and lack of training as a reason for noncompliance. Number two, OSHA regulations and compliance. The OSHA's General Duty Clause states that each employer, one, shall furnish to each of his employees employment and a place of employment which are free from recognized hazards that are causing or are likely to cause death or serious physical harm to his employees. Two, shall comply with occupational safety and health standards promulgated under this Act. Each employee shall comply with occupational and safe health standards and all rules, regulations, and orders issued pursuant to this Act, which are applicable to his own actions and conduct. The OSHA's General Duty Clause applies here because A, the hospital has not provided an environment free from recognized hazards, the lifting and positioning of patients without the use of assisted equipment, lack of training, equipment availability issues, and time constraints, and B, the employees are not following the safe patient handling protocols that are in place, and because of their conduct, they are contributing to their own health issues. Proactive measures that the hospital could have taken to avoid citation would have been to first have an injury illness prevention program in place, which should include responsibility, compliance, communication, hazard assessment, accident exposure investigation, hazard correction, training and instruction, and record keeping. Second, the hospital should have completed a job safety analysis by using a template to determine risks involved for nursing staff and by also looking at the job description to see what physical demands are required. The hiring manager, who should have extensive knowledge of every job within the department managed, should always review and approve the description, any other job specific information, or physical demands. Third, after each incident, a supplemental accident investigative report should have been deducted to determine the root cause of each injury. Fourth, the hospital should have a new employee safety orientation. Fifth, a safety plan should be in place. Sixth, a self-evaluation study could have been completed. Finally, the hospital could have developed a safety program using the Cal OSHA e-tool. Root cause analysis. Beyond the lack of equipment use, organizational factors or cultural factors that may be contributing to unsafe practices may include a lack of proper training on not only the safe patient handling protocols, but also on the proper use of the lifting equipment. The safety and health manager is not doing his or her job in addressing the injuries when the first few occurred. If the supervisors had completed a SARE, they would have seen the causes of the injuries and could follow through to ensure everyone received proper training on the lifting protocols and proper usage of the lifting equipment. Supervisors are also being negligent and not reprimanding their employees for not following the safety protocols. Employees have made a habit of doing the lifting by themselves because no one for at least a year has told them that they are doing it incorrectly. There may also be a culture of completing rounds quickly in a certain amount of time, so waiting for a lift team or locating lifting equipment may take too much time. There might be greater emphasis on time management speed than on safety in the organization. Number 4, solutions and recommendations. I propose the following multi-tiered safety intervention plan. 1. Reevaluate and or update the current IIPP. Determine who is responsible for compliance in all aspects of the program. Number 2, complete a job safety analysis using the physical demands of the job description for the nursing staff as a guide. I would also have nursing staff complete an ergonomic self-evaluation study to have a first-hand account of what they do during a typical workday. Number 3, start the implementation of SARES, which will reveal the cause of workplace injuries and accidents so they can be addressed. 4, design a safety program using the Cal OSHA e-tool for hospitals. An effective safety program includes management, leadership, and commitment, employee involvement in safety initiatives, hazard control measures and risk assessment, regular communication and safety training, continuous evaluation and program improvement. We need to get data from the finance department to determine numbers versus cost. How much money is a hospital losing in employee absences, workers' compensation claims, and turnover of staff versus the cost of additional equipment and training? And we would refer to the OSHA Safe Patient Handling Programs Guide to determine which equipment would work best for the hospital, permanent or portable lifts or transfer sheets, and whether the hospital should have a minimal lift policy or a dedicated lift team. Thank you.